Adrenergic agonists. What are they? Let's talk about that.
Hi, my name is Trey Wisdom. I'm a nurse practitioner student here at Auburn University, here to talk to you about a drug class called Adrenergic Agonist. Adrenergic agonists are a broad category of drugs that vary depending on the type of receptor they're stimulating. They can stimulate either alpha 1, alpha 2, beta 1, beta 2, and sometimes even beta 3, but we're not going to cover that. Most of these drugs are for life-saving measures, and you will see more or less in the critical care hospital setting. I'm not going to go over that, as I'm trying to put that life behind me, and I'm going to go over some drugs that are that you will see in the primary care setting. Adrenergic agonists stimulate, like I said, either alpha 1, alpha 2, beta 1, or beta 2, and are going to vary on their clinical use depending on which receptor they stimulate. So therefore, their therapeutic effects are going to vary depending on that as well. They can vary from vasoconstriction, bronchodilation, GI motility, or even cardiac conotropic and inotropic effects. So again, depending on the receptor they stimulate, adrenergic agonists will either indirectly, directly, or mixed act on the various receptors. So now let's talk about some pharmacokinetics. In the absorption and distribution of these types of drugs, again, with this category being so broad and each drug doing a different thing, that's really going to vary on what the drug is intended for, used for, and what receptor they're going to stimulate. So this is a broad category of drugs, and given that they can be absorbed and given in many different ways via intravenous, intramuscular, oral, or transdermal. So pretty much any way you can think of, these drugs can be given. They're mostly metabolized in either the liver or the kidneys and are mostly excreted through the kidneys. Some precautions for these drugs include for oxymetazoline, you want to use precaution in patients with high blood pressure, enlarged prostate, diabetes, heart disease, and an overactive thyroid. For methyldopa, you want to educate your patients that they may experience dizziness, lightheadedness, or fainting, especially when they get up from a lying or sitting position. For clonidine, you want to use precaution in patients with a history of kidney disease or heart rhythm problems. For albuterol and salmeterol, you want to use precaution for patients who present with hypokalemia. And epinephrine, you want to use precaution because this is only intended for life-threatening anaphylactic shock. So, the contraindications for these drugs are going to vary depending on the type of receptor that is being stimulated. For alpha 1 receptor agonists, they're contraindicated in patients who suffer from hypertension, bradycardia, BPH, or anyone using medications that will increase blood pressure. For alpha 2 receptor agonists, they're contraindicated in patients who have low blood pressure, and geriatric patients may experience an increase in falls due to its sedative and hypotensive effects. For beta 1 receptor agonists, they are contraindicated in patients who have arrhythmias. For beta 2 agonists, they are contraindicated in patients who have hypokalemia. The average drug reactions for adrenergic agonists vary, especially because this category of drugs is so broad, and the most common adverse drug reactions involve in changes in blood pressure and heart rate. The drug interactions for this category of drugs are going to vary, again, depending on the drug you're talking about. But the main point that I want you to take away from this is that these drugs often interact with each other, such as albuterol and epinephrine, clonidine and phenylephrine. Another drug interaction that you need to be aware of is salmeterol will interact with any drug that prolongs the QT interval, such as macrolide antibiotics. The indications and clinical use and rational drug selection, again, are going to vary depending on the drug you're talking about. Oxymetazoline is for the temporary relief of nasal congestion for someone with hay fever. Methyldopa is for the treatment of hypertension, especially those in pregnancy. Clonidine is for the treatment of hypertension, ADHD in kids, and neuropathic pain in cancer patients. Albuterol is for the treatment of acute bronchospasm and bronchospasm prophylaxis, reversible obstructive airway disease, and exercise-induced bronchospasm. Salmeterol is for the prevention of asthma and maintenance of COPD symptoms. Epinephrine is for emergency treatment / reversal of life-threatening allergic reactions. For patient education, you want to educate your patient depending on the particular drug that you have prescribed. For methyldopa, you want to educate your patients on standing up slowly from a lying or sitting position so that they do not experience any orthostatic hypotension and potentially fall. For clonidine, you want to educate your patients on signs and symptoms of hypotension, as well as educate them on how to keep a blood pressure log and bring it back to you at the next follow-up visit to ensure that the drug is being used properly and is working well for the patient. For albuterol and salmeterol, you want to educate your patient on signs and symptoms of hypokalemia and to contact you immediately for any of these signs and symptoms. As well as for albuterol, you want to educate your patients on how to properly use an inhaler and have them do a return demonstration to ensure that they properly know how to use the medication. For the EpiPens, you want to make sure, again, that they know how to properly use this medication and when to use it. Make sure that they know it's for life-threatening emergencies and not just any allergic reaction. It has to be anaphylaxis. The main takeaways I want to leave you with are these. Adrenergic agonists are a broad category of drugs that vary depending on the type of receptor they're stimulating. Albuterol and clonidine are both safe to be used for children. Albuterol is safe for kids with asthma, and clonidine is safe to use for kids with ADHD. Methyldopa is the #1 drug of choice for pregnant women with chronic hypertension. It is a pregnancy category B. Epinephrine works on both alpha and beta receptors. So you want to be careful because my fifth takeaway is that a lot of these drugs interact with each other, such as epinephrine and albuterol. Albuterol works on the beta-2 receptor, and epinephrine works, like I said, on both alpha and beta receptors. So if you have a child with asthma that's taking albuterol once a day and they have an anaphylactic reaction to bee stings and you want to prescribe them an EpiPen, you have to be careful because these two drugs interact with each other given that they both react or stimulate the same receptor. Okay, so enough of all that boring stuff. I will show you guys a fun way to remember all this information.
We love alpha!
We love beta!
I really like beta receptors. I like alpha. Beta. Alpha. Beta. Alpha! Beta! Alpha! Beta! Alpha! Beta! Alpha! Beta! Alpha! Beta!
Guys. Both alpha and beta receptors are awesome. I love both of them. So we should all get along.
You're right.
Beta!